Yeah, so Dr. Arpan is a well-known figure, and he's a pathologist and a very right hand for all ophthalmologists. Takes care of the microbiology at Dr. Shroff Charity Eye Hospital and also histopathology. So he will be speaking on role of a super specialized histopathology lab in ophthalmology. Dr. Arpan,
Thank
please.
you, Pallavi. So Pallavi and me have been working on cases and I've learned a lot, like I learned from all the clinicians. So I'm basically a pathologist and I've been in Shroff for the last 9 years. So just requesting if, am I supposed to? So histopathology is all about colors and interpretation of colors. So we get biopsies from 40 to 45 centers all over North India and also from Central India, and it's for various conditions, benign and neoplastic. It has diagnostic precision, prognostic value, as well as therapeutic guidance, depending on the lesion and the thing. Our workload is usually varies from corneal buttons, uveal tissue, all oculoplasties. We also get lenses to see calcium deposits and of course a lot of tumors and all. So the procedures that we do, apart from electron microscopy, we do all that in our in-house. Electron microscopy we outsource because our workload for our electron microscopy so far isn't much. There's a lot of stress on kidney biopsies for electron microscopy, but we are also establishing it. These are the common lesions we see. I'm going to be showing you a few pictures, and each one of them is important for the prognosis and the treatment. The initial assessment, a very important part in histopathology, is apart from the requisition form. So the histopathology report is a medical legal document, just like a discharge summary. So it constitutes demographic details and clinical details, which are very important. And then is the procedure which happens in the lab, grossing, where you actually orient the tissue. We have fellows as well as our consultants who are in with us many times for specimens, because the way they see the specimen in an OR and the way we get it could be different. Though we have a electronic medical record system which talks to each other, but it's nothing like talking to each other. Like I would talk to Dr. Pallavi for a case. I mean, she would throw her clinical insight. So I mean, it's always good to be speaking in actuality to each other, and I mean, there's always something. So this is an important part where we have them in the histopathology lab, if it's within. We even have people coming in with the biopsy, sometimes doctors, because they are precious biopsies on filter paper, and you don't want a courier sample to throw it in and around, because for them a biopsy sample and an envelope of a paper or anything else is just the same. The sensitivity is not there. So we have a tie-up only with Blue Dart and Tracon. We don't accept anyone else because we burnt our fingers with other courier samples also, courier providers. Few pictures of the grossing. I'm going to try to play this video. I hope it works. It's a 1-minute video.
Histopathology is a very important part of ophthalmology.
Sorry for the glitch.
Histopathology is a very important part of ophthalmology. It involves the process when the surgeon takes out the biopsy and sends it in 10% formalin. After that, the grossing process is done. The grossing involves the visualization of the specimen, identification, and checking the labeling. Different sections are taken during the process of grossing. The biopsy is then put into a tissue processor for overnight fixation and processing. After that, the next day, the biopsy is then converted into by multiple steps into paraffin embedded blocks. The paraffin embedded blocks are then cut in a microtome and H&E, hematoxylin eosinophil stain, and various other special stains like PAS and others are done according to the histopathologist. After this, the slides are made and viewed on a digital microscope and fluorescent microscope by the histopathologist, and relevant areas are visualized, screened, and reported along with a very detailed report of microscopic.
So just pausing it here. So there are two setups that we have. One is the biopsy coming in, and then we also offer digital pathology services for anybody who cannot send us biopsies. So they can process the biopsies and they can send the readout through a digital system where we report it out. So we have an iPad connected to a computer where any smartphone image which comes in from preferably a pathologist or at least a histopath technician can be read out, because we understand that we cannot cover every area. So we trying to, and there are just 9 ocular histopathology full-fledged labs. So we trying to build a system where we can accept and report it out. So I'm just paused it for that. So there are a lot of different lesions that we get. I'm just going to show you a few pictures. I'm not going to describe them because we'll have people yawning here, but just want to tell you that we play with a lot of colors. So these are all taken from the digital. We use them for publications, we use them for research, and of course we use them for clinical work. We usually get one of these in a week at least, either in-house or outside. All our secondary centers, if you're familiar with the Dr. Shroff's charity model, sends us biopsies. It's only done in one unit, but all of the others have ocular microbiology full-fledged labs in all our secondary centers. But the histopathology is only done at the main lab in Delhi. So it's a teaching tool. A high-rated cyst, the cysticercosis is something we see very often from our plasty. We used to get ENT biopsies. We closed down ENT on 1st July, so this is a slide from them, neural tissue. To our surprise, we've picked up OSSNs from pterygium biopsies. So as a histopathologist, I would always say never throw a specimen. Send it to the lab. It will surprise you many times. We've had cases of phthisis bulbi turning up to RB. We've had cases of corneal scars turning up into corneal dystrophies. The surprises are galore. Just like for you in the clinics, every case doesn't look the same. A bacterial could be a fungal and vice versa. There are examples of it. This was one of our publications, molluscum. We do all special stains. We don't do IHC. We outsource it, but the reporting is done by me. It comes into us. Immunohistochemistry for people who would not be familiar. Basically, clonality and the lineage of cells is. So I'm running short of time, so I'll just wrap up. It's for our role is from morphology to defining the tumor to genotyping and transportation. It's important, as I started saying, a two-way communication. The more you speak to each other, the more pre-analytical errors you take care of, and the more is the patient finally gets what they deserve. And so a detailed report follows. We are integrating into molecular genetics very soon. We already offer digital pathology, and I hope I'm replaced by artificial intelligence, and after 30 years of being in this profession, I just sit and look at somebody else doing my job. That's the dream. No, it's not. Nobody, no. And we always looking, thank you for your kind words. We are also looking for collaboration, and anybody wanting to do anything that involves histopathology, whether it's research or clinical work, we are always there. And I can share my details with anybody who wants. So, thank you. There are challenges, but then the future is very bright, as I said, AI and multiplex genomics and that. Work as a team, thank you. And of course, my last slide. Everything looks so very artistic to us.
Colorful, animated.
So
interesting.
This is more a show-off slide than anything else.
Okay.
Yeah. Okay, thank you.
Thank you, Dr. Arpan Gandhi, for the wonderful lecture. and you took us back to our student days in pathology because we never had any contact with histopathology after coming into ophthalmology. In the real sense, the histopathologists and the microbiologists are the Sherlock Holmes and Agatha Christie for ophthalmology, because you help us finding out the real thing from the clues. Otherwise, we would be lost. Because in so many differential diagnoses, you help us to pinpoint from the various clues and reach at the final diagnosis. So thank you for that. I just wanted to ask one question. How do we transport all these specimens? Lid specimen, conjunctiva cornea, in which medium,
yeah,
sir?
Great one. So every biopsy, if it's only for histopath, is transported in 10% formalin, where the volume of formalin should be at least 10 times the specimen.
Okay.
And of course, if it's a non-filter paper, it needs to be sealed properly with the parafilm, okay? Because if you're sending it by courier, as I said, it's going to be thrown around, and you don't want formalin leaking and the tissue getting autolyzed. If it's a filter paper, you have to suture it properly. You have to use filter paper number 1, Wattman filter. If it's not available, it can be sent to you. And if it's, I'm not going to talk about frozen sections because probably the audience is not there, but pre-information for specimens which require special pre-analytical transportation and care is always works. So if you or someone just can tell us that this is what we are going to send, we could probably, if I had it in one of my slides, that we could probably tell you this is how you could send it.
So the whole gross specimen will be sent in 10% formalin?
Correct, yeah.
Okay.
So that specimen, if it itna hai, to itna to formalin hona chahiye.
Okay.
Because if
It doesn't get dehydrated in
no,
formalin? Oh,
it doesn't.
I had that misconception.
It gets preserved. It's a good question. It's
Yeah.
a good dehydration because you're anyway out of the body. So
Yes.
it gets preserved and it's easily there for 14 days with no issues at all. So even
Okay.
till 10 days prior surgery to a biopsy coming up, we accept. Not like microbiology where everything needs to come in within a specified time.
So no other medium like RL or
So no
NS,
RL, no
nothing like
RL
that.
unless you want microbiology along with it. You divide the corneal button into microbiology, send it in
Yes.
saline and the histopath.
Okay.
The only other media that is done is Michel's media or cold saline for direct immunofluorescence, for OCP and other cases. But otherwise everything else is formalin.
Okay, sir. Thank you. I had
Thank you.
that doubt from a very long time.
No, it's a
Yes.
doubt that needs to be answered if you
Yes,
need to
yes,
get the
sir.
right question,
Yes.
right report.
Yeah.
Okay.
Thank
Thank you.
you, sir.
Thank you so much. Any other questions? Okay. Thank you.